Welcome back. A child's smile can really light up a room, but behind that smile could lurk some dental issues that can cause some pretty serious problems. According to the Center for Disease Control, in fact, 50% of 5-year-olds have at least one cavity or filling, and tooth decay is considered one of the leading childhood illnesses. Now, since February's National Children's Dental Health Month, our partners at Colorado Parent Magazine asked Denver area dentists for some answers to some parents' questions. I have a lot of common questions about children's teeth. So Dr. Kimmy Houston, a board-certified pediatric dentist, is here to address some of those frequently asked questions that we all have as parents. So thank you for coming. We appreciate it.
Thanks for having me.
First and foremost, as a parent, when you're picking a dentist, what kinds of things should we be looking for?
As a parent, you want to pick a board-certified pediatric dentist.
Okay.
Board-certified pediatric dentists go to school for 2 years longer than general dentists, and we train to treat children from birth to 18. So we learn all the different drug dosages, all the different behavior management ways to make the visit really easy for children. So a board-certified pediatric dentist.
That's a very, very important element. When should you first take your child to the dentist?
By the first birthday or by the time the first tooth erupts. And the reason for that is we like to do a risk assessment in our office to try to determine what tools the parents need to help them help their children to prevent decay. We like to see the children cavity-free by age 3 and beyond.
That'd be nice.
Yeah.
So I know a lot of parents are thinking, well, I need to get in there and help brush their teeth. When should they start doing that?
As soon as that first tooth erupts, they should take a little toothbrush and get in there. Tiny little smear of fluoride toothpaste is all. Not a big ball of toothpaste or a strip like we use, but just a tiny little smear of fluoride toothpaste on those teeth twice a day.
Just helps. Twice a day?
Twice a day, morning and night.
With all the advances we've had in dentistry, this is still an issue with children and cavities. What are some of the high risks? Why?
So one of the things that causes a lot of decay is the frequency of sugar and the type of sugar. So simple carbohydrates, frequent sugar, sticky taffy foods, those type things make cavities more frequent in children's teeth. The other thing is the mother, believe it or not, transfers the bacteria, Streptococcus mutans, to the child in about 71% of children. So that bacteria is already there, ready to produce cavities as early as that first tooth erupting.
So you need to get on it in a hurry.
Right away.
It's right there.
Right.
What about when you talk about cavity-free? That's not impossible. It can be done these days for a child. It can be done.
That's right. That's right. We like to see children, like I said, cavity-free by age 3, and one of the ways to do that is brush for your child morning and night until their dexterity develops to the point that they can at least tie their shoes. If they can tie their shoes, they can probably brush their teeth alone. If not, you need to brush for them. And that age can vary for every child because they all develop differently. And then you want to be sure you bring them to the dentist every 6 months for fluoride treatments and examinations. Fluoride water helps tremendously with the developing permanent dentition. And then just reducing the frequency of sugars and snacks in the diet, replacing those things with fresh fruits and vegetables, popcorn, cheese, things like that.
Yeah. As a father, I don't know what's harder to do, get the kids to turn the light switch off or get them to brush their teeth.
Exactly.
Do you have any tricks in helping children get them enthused about doing this?
You know, just bringing them early to the dentist really gets them enthused about it. And if they come every 6 months, that motivation factor just keeps getting reiterated. So it makes it easier for the parents to kind of get them in the bathroom to brush their teeth easier.
Yeah, and then make it easier on the parents.
Exactly.
And ultimately, that's a big help, too.
And ultimately on us, right?
Help the parents out. Come on
exactly.
All right, Dr. Houston, thank you. We appreciate it. Again, this month's issue of Colorado Parent Magazine answers all kinds of questions like this. Like, is it safe to visit a dentist during pregnancy? Tips for taming teething tantrums. You can read all this information, some great resources for you. You can read the magazine online. We have a link on our website. If you go to thedenverchannel.com and you're at the top of the page, you click that big red TV button, we'll get you right to it. Bertha?
Good information.